Hi there, thanks for coming. I've got Patricia here. She's come in feeling very sick with what might be a fever and some cramping. I don't have any more details. Would you mind assessing her? There may be some more information on the computer if you need it. I'll be out on the floor if you need me. Just give me a call on the phone anytime.
Hi, Patricia. Nice to meet you. I'll be taking care of you today.
Hi, nice to meet you. They sent me right over from the OB office. I hope that everything is okay.
I'm really glad we came over here. I've been very worried about her and the baby.
Do you have any questions?
No questions for now. I just hope she's gonna be okay.
Hello. Do you mind me asking what relation you are to her?
Of course, I am Patricia's husband.
I'm sure you've been very worried about your wife and the baby. I will just complete my assessment of Patricia so we can work out what's wrong. Then we'll make sure she gets the right treatment.
Thanks for keeping me updated.
Please verify your name for me. And how would you like to be referred to?
My name is Patricia Jackson. I prefer being called Patricia. Thanks.
Can you confirm your age and date of birth?
I'm 27 years old, and I was born on July 23rd.
What pronoun should I use to address you? For example, would you like he, his, him, she, her, hers, or something more gender neutral such as they, them, or that person's?
She, her, hers works for me.
Do you have any questions for me?
Not right now, thanks.
How do you feel now?
I feel okay, but I'm starting to feel kind of chilled.
Can you tell me about what's brought you in today?
A couple of days ago, I started feeling some extra wetness. I thought it was just a normal thing, but then today I felt more of that and I started feeling crampy and a little crummy, like I was coming down with something. So I called the office and they took a swab of the fluid, but then sent me right over here.
Okay, so you noticed some discharge. Anything else?
Yeah, well, I've had this cramping right where the baby is. It seems to be getting more frequent.
She's been very uncomfortable, very sweaty, and in general, just not herself. I hope this isn't something serious.
When did you start having these issues?
I noticed a little bit of extra wetness a couple of days ago, but today it seems like there's more.
We use pain scales with 0 being no pain at all, and 10 being the worst pain you've ever felt. How's your pain now?
I don't think I'm really having any pain. Maybe a 1 or 2 because I feel a little crampy now.
Okay, are you experiencing any pain elsewhere? Like at the top of your stomach area? Can you describe the discomfort and how often it occurs?
No, I'm not feeling pain up top, just down low, like period cramps. It kind of comes and goes.
Have you had any fever recently?
I haven't taken my temperature, but I'm starting to feel like I have the chills.
I'm going to attach the blood pressure cuff so that I can get a baseline reading. I'll be able to recheck your blood pressure easily from the EFM machine.
I hope my wife and the baby are going to be all right.
I'm going to put these straps on now if that's okay. We use these to measure contractions and to record the baby's heart rate.
No problem.
The baby's position seems to be vertex. I will record your vital signs under Document Maternal Vitals on the computer. That way we can monitor any trends that occur while you're here with us. respiratory rate is a little high. At the moment, it's about 24 breaths per minute. Right, that's all of the vital signs documented on the computer. Cap refill time is 3 seconds. Strong pulse with noted tachycardia. And aside from the issues you've mentioned, do you have any medical history that we should know about? Diabetes, high blood pressure, migraines, for example?
No, I haven't had any problems with my health at all.
Have you been exposed to any contagious diseases lately, or to anyone who has been sick?
No, not that I know of, but I am a teacher, so I'm around kids a lot.
Have you had any previous surgeries or general anesthetics?
I had my wisdom teeth out when I was younger. That's it.
Can you tell me what medications you're taking, please?
Just my prenatal vitamins.
And are you taking any non-prescription medications?
Nope, just the prenatals.
Do you have any allergies to foods, latex, or medication?
I have some seasonal allergies, but other than that, no.
Can you tell me about where and with whom you live?
I live at home with my husband and my son.
Do you smoke or have you ever smoked?
No, never.
How much longer will it be before we know what's going on? I'm very concerned.
Do you drink any alcohol or use any recreational drugs?
Not during the pregnancy. I used to have a glass of wine or a beer once in a while. Never taken drugs. Not my thing.
How has your sleep been lately?
Terrible. I just can't get comfortable anymore.
That's not uncommon, unfortunately. Try not to worry. We'll make sure your wife and the baby are monitored closely and kept comfortable while they are here.
Okay, I appreciate that. I can't help but worry, but that does make me feel a bit better. Thanks.
Legs appear normal, no pedal edema. Calves are soft and non-tender, and there's no obvious erythema. Deep tendon reflexes normal. Negative clonus noted. If you are able to, I'd like you to lie on your left side to help with circulation to you and your baby.
I'm sorry, I really can't. It bothers my back.
I'd like to bring your gown down to check your skin. Is that okay?
Sure, that's fine.
On completion of a full skin examination, there is no rash or abnormality on the upper body, no leg edema noted. The completed skin assessment chart is on the computer.
Hi there. Let me know if there's anything I can do to help.
When did you start having these issues?
I noticed a little bit of extra wetness a couple of days ago, but today it seems like there's more.
Can you tell me about what's brought you in today?
I'm just not feeling well. I thought someone said something about my water breaking. I'm really worried now. It's way too early for that.
Have you noticed any odor coming from the discharge?
I don't know. I don't think so. It may smell a little different than before.
Okay, thanks for your call. That is a concerning history and set of vitals, I agree. Can you make sure you've reviewed the latest EFM strip, performed nitrazine testing, and give me a call back with the results? Thanks.
I'd like to raise your gown to perform nitrazine testing. Is that okay?
Sure, that's fine.
It's been about 15 minutes since I first took your blood pressure. I better check it again, and this time I will do it manually. Positive test upon completion of exam. Small amount of clear fluid observable. No foul odor noted. I've retaken your blood pressure.
Okay, thanks. The strip is concerning, I agree. We may be dealing with chorioamnionitis, given the discharge she has been having over the past few days. Can you please run some labs and include blood cultures, CRP, coagulation panel? Please call me back with the results and we'll go from there. Be sure to keep strict INOs and maintain your oxygen sats above 94%. There are guidelines on the computer you can refer to.
The IV access is in place. The blood cultures have been taken. That's done. All the relevant tests are ordered. I'll get them processed right away.
We're going to insert a catheter for you now, if that's okay.
Sure, if you feel it's needed.
That's the catheter in place.
No problem. I'll start strict fluid monitoring. You'll be able to see the fluid balance chart on the computer.
Thanks. I appreciate the thorough assessment. I agree with your concerns. Her blood results are indicative of an infection, and although we don't have any results yet on her swabs, we should begin treatment for chorioamnionitis. She'll need an IV if not done already, and I've put orders on the computer for acetaminophen, antibiotics, and fluids. Keep rechecking her vital signs every 15 minutes and monitoring her oxygen saturation for greater than 94%. When all these meds have been given, call me back and we can go from there.
Okay, that medication's given. Okay, that medication's given.
Those fluids are up and running. I'll let you know when the bag's finished.
How do you feel now?
I feel hot and a little crampy now. I'm really worried about the baby.
Let me update you on what's going on at the moment.
Thank you so much. It helps to know what's going on.
Let me update you on what's going on at the moment. Let me update you on where we are clinically at the moment.
Thanks for keeping me updated.
Okay, thanks for updating me on the situation and progress.
Thanks. I appreciate the thorough assessment. I agree with your concerns. Her blood results are indicative of an infection, and although we don't have any results yet on her swabs, we should begin treatment for chorioamnionitis. She'll need an IV if not done already, and I've put orders on the computer for acetaminophen, antibiotics, and fluids. Keep rechecking her vital signs every 15 minutes and monitoring her oxygen saturation for greater than 94%. When all these meds have been given, call me back and we can go from there.
I've retaken your blood pressure. I've retaken your blood pressure.
That bag of fluid has finished.
Okay, that medication's given. How do you feel now?
What I was feeling before seems to have subsided. Thanks. I just hope that my baby is going to be okay.
Thanks for beginning treatment on this patient. Continue to monitor her vital signs and INOs, and if she is stable, you can move on to your next patient. I'll be down shortly to assess her.